Hello, I'm Dr. Sandeep Basin from Carewell Medical Center. Today we'll be talking about the treatment of white patches by a special method called melanocyte transplantation. The white patches or vitiligo is a very common condition that people suffer from, and we can divide it basically into two types, stable and unstable. What we mean by stable vitiligo is the white patches are not increasing, the size is not increasing, number is not increasing. So once we see this, the disease is stable, no new patches are coming, then we have an option for doing a surgery for these white patches. We can use various surgeries like skin grafting, punch grafting, dermabrasion, etc. But the disadvantage with these surgeries are that they all have their own limitations and the cosmetic results are not very good. The best cosmetic results are with the procedure called melanocyte transplantation. So let's see what we do in this procedure. Basically we take a skin graft and separate melanin pigment from this graft and transplant it on the white patches after dermabrading that area or making that area raw. Now let's see the whole procedure. This is a patient lying down. The first is very good and fast. The graft is taken. Now putting this graft in a special solution in this bottle, in this test tubes. This solution is Trypsm. So we put it in Trypsm and this is being incubated for about 30 minutes in a laboratory. So this is putting in an incubator now. This we leave for 30 minutes. Meanwhile we come to the recipient area wherever there are white patches. We make that area raw by using a technique called dermabrasion. There is a machine that is being used. And now the area has been dermabreded. 30 minutes have already passed. That material is now bought from the incubator. We neutralize it with anti-trypsin and Dulbecas media. So after neutralizing this solution of trypsin, we put it in a machine called centrifuge and then centrifugate for a few minutes. So this centrifugation is important to separate the melanin pigment from the skin. Sometimes we do this centrifugation 2 times or even more, so that separation is good. So this centrifugation is going on, and now what we can see is at the end of this there is a brown color pigment in this test tube which is separate from the clear fluid above it. This brown color pigment is called melanin pigment. This is what we have been working hard to get at. So we take this melanin pigment, take it in our test tubes, pipettes, and now we spread it to the recipient area where we require to bring the color. So this is spread gently over the recipient area, spreading it evenly and equally in all the recipient area, not leaving anyone free without this melanin pigment. Once we are put, then we are covering it with a special dressing called Collagen Dressing, and we do the dressing. So this is how this procedure of melanocyte transplantation is done. And after a few weeks, sometime we put them on narrowband UVB light or on some medication, and the result generally come in 1.5 to 2 months. Melanocyte transplantation is cosmetically much better than grafting or punch grafting. It is very well suited for the white patches of the face, lips, eyes, where it gives the best results. And the healing is so good that sometimes we are not able to say whether the patient has undergone any treatment or not by if we take melanocyte transplantation. Thank you. I'm Dr. Sandeep Basin from Carewell Medical Center. Nice talking to you. Thank you.